Hi, I'm Karina Seagrave. I'm the researcher in this project, and the pregnancy and birth narrative shared is mine. I'm here with my friend Kristen, who served as my doula through pregnancy and birth. And I just want to give Kristen the introduction she deserves. So, Kristen is a DONA-certified birth doula, postpartum doula, placenta encapsulation specialist, and founder of Birth Roots, a birth and postpartum doula agency rooted in Vero Beach, Florida, focused on empathy and service. How are you today?
I'm doing well. Thank you for having me.
Of course, so happy to have you. So I'm interested in sharing real life narratives of women during the overturn of Roe v. Wade. So I'm going to ask you a couple of questions about your experience. And the first one is, what is a doula and what services does a doula provide?
A doula is a person who provides informational, physical, and emotional support through pregnancy, labor, and delivery, and also postpartum.
Great. Yes. I think a lot of people are unfamiliar with the term, even though it's a term that's very old and a huge tradition of births and women and babies. So our next question has to do with Roe v. Wade. And so the question is, how has the overturn of Roe v. Wade affected your job or your clients, or how will it in the future?
So it actually hasn't affected me so far, mostly because I see people when they're much later on into their pregnancies. But I do expect to see a lot more clients who are seeking support in miscarriage management and in pregnancies that they don't want to be having for a number of reasons. People will be unable to access necessary medical care to safely and effectively manage their miscarriages. Also, I expect to work with a lot more people who didn't plan to be mothers and don't have the tools to be mothers or parents.
Okay, yeah, sure. Speaking of people that don't have the tools to be mothers, can you tell us a little bit about your work outside of your company that you do with the Healthy Start Coalition?
Yeah, so I've been a doula with the Healthy Start Coalition for about 4 years now. And we provide doulas to people in the community who need them. Some people want a doula for a number of reasons. A lot of people need a doula because it is a matter of having your wishes respected in birth and pregnancy and having someone to really guide you through that process if you have no one guiding you through it, especially among marginalized people. Advocacy is very important, especially in a hospital setting. And we can see that with maternal mortality rates, especially among women of color, are much higher than those of white women.
Great. Yeah, thank you. That's a
So, oh, sorry, I kind of
great
stopped there.
organization. Go ahead.
Yeah, but at the Healthy Start Coalition, we provide doulas to people who need it and we guide them through the process. And we also provide them with childbirth education and lactation counseling if that's how they decide to feed their baby. So we cover their bases and give them the tools that they need.
Great. What a great program. A great organization to be a part of, I should say. Okay, and our last question is a heavy-hitting question, if you don't mind sharing. What are your thoughts, beliefs, or professional opinions regarding access to abortion?
I think abortion needs to be easily accessible because abortion is healthcare, and those who don't agree with that should not have an abortion. I've seen people traumatized by birth at the hands of their medical providers, and to force someone to have a baby could be inflicting so much hurt on them, not just hurt, but potentially death.
It's a huge issue. Thank you so much for sharing your thoughts today and for being the best doula to me and my son. We're doing great, and part of it's because of you.
I'm so grateful to have worked with you.